Physiology of the first 100 hours. The hormonal shift. What happens at birth? During pregnancy, high progesterone keeps milk production suppressed. After childbirth, the placenta is gone, progesterone drops rapidly. This drop unlocks the breast and allows prolactin to act. Secretory activation typically occurs between 30 and 72 hours postpartum. The breast is now listening for a signal. Is milk needed? For most of pregnancy, the breast is ready to make lots of milk, but is actively held back. Progesterone, which is produced by the placenta, acts like a brake. The moment the placenta comes out of the mother's body, that brake releases. Progesterone plummets, and prolactin, which has been building throughout pregnancy, can finally do its job. This is secretory activation, or what parents often call their milk coming in. It really isn't that, though. It's already there, and it increases in volume, typically somewhere between 30 and 72 hours after birth, though it can be earlier or later, depending on a lot of factors. The key point is that the breast has shifted from waiting to listening. It's making more milk while asking, does anyone need this milk? And it determines the answer based on whether or not milk is being removed. A critical window for establishing milk production is happening in the first 100 hours. Early, frequent milk removal is consistently associated with higher, later milk volumes. The breast transitions from hormone-driven or endocrine to demand-driven or autocrine control. What happens in these hours shapes milk production for weeks and months. The window doesn't close completely, but it's never this responsive again. Here's what the evidence consistently shows. Parents who begin milk removal early and maintain frequent expression in the first days produce more milk later. The exact mechanism is still being studied, but the pattern is robust across multiple cohorts. What we know is that early lactation is primarily hormone-driven. Prolactin is high and the breast is primed. As the days pass, control shifts to a local, demand-based system. The breast makes milk based on how much is being removed. This transition happens whether we pay attention to it or not. The first 100 hours are when we have the most physiological leverage or influence over this process. We can still build milk production later. It's not impossible, but it requires more effort and there are no guarantees. The system is never quite this responsive again. That's why timing and frequency matter so much, especially for mothers whose babies are not able to drive this process at the breast because they were born early. Why NICU parents are at higher risk. Separation disrupts the feedback loop between baby and breast. Stress, trauma, blood loss, and medical complications can delay copious milk production. Pump signals are weaker than infant signals. Frequency must compensate. Without proactive support, parents may miss the window without knowing it existed. NICU parents face a perfect storm of risk factors for low milk production. First, there's separation. The baby isn't at the breast sending signals. Second, there's often a complicated birth history, prolonged labor or extremely fast labor, emergency surgery, medications to lower blood pressure or to attempt to stop labor. All of these can delay secretory activation. Third, the pump sends weaker signals to the breast than a baby. A healthy term newborn is remarkably efficient at getting the milk they need and triggering the hormonal release the breast needs to receive. A pump does its best, but it's mechanical. Proper pumping technique takes time to master. To compensate, we need to increase frequency and optimize technique. Hands-on pumping, breast massage, ensuring mothers are using the best pump for the situation, correct flange fit. We can't forget to explain why we help them use a high-quality, multi-user pump in the hospital. It's because this is a very special situation. If they don't know that, they may go home and use a less effective pump or a wearable pump instead of prioritizing obtaining the high-quality pump they actually need at this time. They think their pumping situation is just like what all the people they know have done for their term babies, but it's not the same. They can't rely on the internet to provide them this specialized lactation education. And finally, there's the information gap. Many NICU mothers don't know any of this. They're told to pump, but no one explains why the first days matter more than the first weeks. By the time they realize their milk production is low, the most responsive window has passed. That's not their failure. It's ours.